Good evening, everyone. Myself, Priya Glani. On the behalf of AHESIA, All India Homeopathic Students and Youth Association, founded on October 31st, 2009, which is dedicated to promoting homeopathy, fostering unity among students and professionals, advancing homeopathic education and research, I would like to warmly welcome you all on today's webinar on ethics in homeopathic practice, balancing patient autonomy and professional responsibility. We have with us Professor Dr. Ruchi Biswas, ma'am. She'll share some valuable insights and knowledge on today's topic. Over to Manali.
Good evening, everyone. Manali Shrivastava this side, and I am thrilled to inform that AHESIA, All India Homeopathic Students and Youth Association, is going to conduct an extraordinary event, that is International Ayush Conference and Ayush Youth Festival 2025, scheduled on 12th January 2025 at Salt Lake, Kolkata, West Bengal. Many other activities like Global Youth Summit, Ayush Literacy Conclave, Arogya Fair, along with some exciting competitions like e-poster, article writing and drawing, etc., will also be organized over there. For more details and registration, you can get link of the conference from our YouTube description box and webinar chat box also. So don't miss out and save the date now. Thank you. Over to you, ma'am.
Hello, are you there, ma'am?
Hello.
Hello, ma'am. Session has been started, so you can continue.
Should I start?
Okay, ma'am. Sure.
Okay, sir. Okay. So today the topic of webinar is ethics in homeopathic practice, balancing patient autonomy and professional responsibility. Sir, about my slides.
I will share. Hello.
Hello. Yes, sir.
Ma'am, can you see your slide right now?
Yes, sir.
Okay, ma'am. Please continue.
Yeah, it's visible now. The topic for today's discussion is, sir, it's not visible right now. Ethics in homeopathic practice, balancing patient autonomy and professional responsibility. Next slide, sir. This is the declaration and oath which we usually take at the time of registration. Next slide, sir. The declaration and the oath that the homeopathic physicians swear at the time of registration is an added responsibility that is supreme. The Hahnemannian oath guides homeopathic practitioners to take inspiration from Master Hahnemann's teachings and obtain the strength to believe in homeopathy. Ethical practice in homeopathy is determined keeping in view the highest and the only mission for the homeopathic physician, as mentioned in the first aphorism of Organon of Medicine, that is to restore the sick to health. So, if we talk about the ethics, ethics is the invisible foundation that upholds the trust between a practitioner and a patient. The role of ethics in medical practice, including homeopathy, is fundamental in which is helpful to maintain the trust, the professionalism, and the quality care which is given to their patients by the homeopathic physicians. So basically, ethics it serve as a guide to ensure that practitioners they act in the best interest of their patients. They should respect their autonomy and uphold the principles of the profession. But sometimes what happens that the physician gets stuck between the situations where the duty of the physician and the respect to the patient autonomy clashes somewhere, and that clashes are sometimes we recommend them as the ethical dilemmas. So there are various ways that we can come out or we can navigate from such situations uh, through which we are helpful in providing the grounded care or the evidence-based practice to our uh, patients. So basically in homeopathy also there are so many dilemmas which they are particular relevant as basically in our pathy we are dependent upon the or we are basically into practice on individualized approaches or the personalized approaches during which we need the careful consideration of the ethical principles for practice. So mainly, I have taken this topic in order to explore all those dilemmas which we face at the time of our practice, and especially those budding homeopaths, those who are running or they are starting their own clinic. So these dilemmas, when they are sorted out, it's the practice would become so soft and so very easy, and the most important thing is that we are able to build up the trust with our patients, through which the relationship between the patients and the physicians can be considered for the long term, which is the basic principle also, that we need to get the follow-ups for the long term relationships for the long term practice. So the basic objectives which I have chosen for this presentation is today. The main thing is that we need to understand the core ethical principles. We need to recognize the importance of the patient autonomy. See, all these things we have studied in the second year in the subject of forensic medicine and toxicology. So the basic thing is that whenever such dilemmas or there's some we are not aware of such kind of dilemmas, then some sort of hesitation or we are not having so much confidence that we can practice homeopathy perfectly. So when we are able to balance between the autonomy or between the rights of the patients and our responsibilities, then the practice becomes so easy for us. Next is with through the help of this webinar, I hope I would be able to navigate some ethical dilemmas practically. That will be helpful for the budding homeopaths. Then the most important point is that in homeopathy, we are giving basically the holistic care. We are providing the holistic care. So by holistic care means that we are not only considering the physical symptoms of the patient, but we need to know about their mentals, we need to about their emotions, we need to about their dreams, some fears, everything. Yani ki we need to consider each and every part of the individual, including their mind, including their spiritual also. So having all these, we need to be very much communicative. We should have some communication skills so that our ethical practice becomes so much perfect. Next objective is to commit to integrity, to be only based on the evidence-based practice. We should be very aware of the new researches which are upcoming. And the most important point is, if we need some ethical practice, our everything which we are dealing with the patients, the case taking, and each and every point which we are guiding to the patient should be transparent. Like we should not hide anything from the patients, maybe regarding the diagnosis of the patient, maybe regarding the treatment of the patient, each and everything. Basically, our motive should be, it should be a patient-centered care. Next slide, sir. So these were the objectives which I think will be fulfilled through this webinar. So starting with the topic about the ethics in the homeopathic practice. So first of all, we should know that what is medical ethics. So by the definition, medical ethics is a branch of the applied ethics that focuses on the principles and moral values guiding medical practice. So it involves evaluating and resolving ethical dilemmas that arise in healthcare, balancing patient rights, professional responsibilities, and the societal needs. So when we are aware of all these ethics, then to build a trust with your patients is comparatively sounds to be very easy. Next slide, sir. So these are the key principles, or we can say these are the pillars of medical ethics. Basically, these four principles. The first one is autonomy, second one beneficence, third one is non-maleficence, and the fourth one is justice. So let me explain these principles. Autonomy is the right, basically, is the right of the patient to get informed about the diagnosis of his disease, about the treatment options available for his disease, what could be the outcome of the treatment, what could be the risks having those treatments, or what could be better to treat with him, maybe through the conventional system of medicines or maybe through complementary system of medicine. So being respecting these decisions or being rights of the patients, it's very much needed for an practitioner to get in touch with the patients and discuss with them each and every aspect that is related with their healthcare facilities, so that the patient can himself or herself decide what to do and what not to do. You are not going to pressurize the patients to, yes, you should take homeopathy for this, or you should get into the conventional mode of treatment. No, it's your mere duty to just guide the patient regarding each and every discussion about his disease condition, and then let the patient decide what to do for himself. Then the next important principle or the pillar of ethics is about beneficence. Beneficence itself word tells us about the benefit. So the main interest of the patient or the physician should only be for the benefit of the patient. The next principle is about the non-maleficence. Non-maleficence means do not harm to the patient. So this is a very important principle in which the mere duty of the physician should be to avoid any giving harm to the patient. The medicine prescribed should always be in their gentle form. And the last but not the least principle is about the justice. Justice is, as the name suggests, that we should have the fair decisions, maybe regarding the sex of the patient, maybe he's a male or she's a female. You should not consider these things. That particular sick person came to you, whether he is of any sex, of any age, any race, any religion, you are not to differentiate any of them. Your aim should only be to show fairness in the mode of treatment. Next slide, sir. So these are the some pictures I have uploaded regarding the principles. The first one is autonomy. That is, we are freeing the patient to make their own decisions regarding their disease conditions. Next one is beneficence. Everything should be in the benefit of the interest of the patients. Next one is non-maleficence. That is, we are not going to do any harm. We are avoiding harm to the patients. And the last one is about the justice. We are always be in the fear of the ensure the justice to the patients. These are the four basic principles or the pillars of medical ethics. Next slide, sir. Now, if we are basically talking about the ethical standard is homeopathy, so these are the main points which should be approachable. And the most important thing is that when we are stick to all this principle, definitely our practice is going to uplift not only ourselves, not only the peer people, but the full will be helpful for all the practitioners regarding the homeopaths. So amongst that, we know it should be based on holistic patient-centric approach. Our pathy should be based on evidence-based, and we should maintain the professional integrity. We should be very privacy, or we should take care of the privacy and the confidentiality of the patients. We should be aware about the concept of the informed consent, and transparency should be maintained, and the financial fairness also should be maintained, and without exploiting the patients. Next slide, sir. So I'm going to explain one by one these basic ethics needed to be or in the homeopathic practice. So as we have already discussed about the holistic care, it's very important that the disease condition which we are going to treat, we should not only see the physical symptoms which are coming to the patient. Every aspect of the patient should be considered, his mentals, his spirituals, everything should be considered, so that we are going to treat as a person as a whole. Next one is individualized treatment. This is a basic principle of our homeopathy also, and this is the most important criteria also, that through individualized when we are giving the individualized treatment means, for example, like some person is suffering from chronic migraine, right? So two patients are suffering from migraine, so each one will have a different aspects of the migraine. Maybe the intensity would be different. Maybe one person may be having some stress sort of conditions, or other person might be suffering from the quality of life is not correct. So every person is different here. So basically in homeopathy, we are giving the person the individualized mode of treatment, due to which so much dilemmas can occur in our practice. And so in order to avoid that, we should be very aware what sort of dilemmas can occur, and how we can navigate through these dilemmas, so that the trust which we have made between our patients, it may remain so good, so that they can be so confident, and even they feel so empowered that they are able to decide they are able to take their own decisions. So in order to build a long-term patient relationships, we need to be aware of about considering these things come under the dilemmas, and how we can avoid that things. So the next point is, it should be patient-centered decision making. This is very important point in the ethics about decision making. We know simple decision making for a homeopath is that when we are considering the individualized treatment, it is based on a particular homeopath, that how he's prescribing his patients, right? He might be consider some points, but actual the holistic case taking as a whole should be considered. But when we are talking about the patient-centered decision making, it's quite a different aspect, in which sometimes what happens, if there occurs any sort of dilemma, and you have allowed the patient for autonomy also, that you have given him the right to decide what sort of treatment he needs to approach, and after that he has given the consent also, yes, I am going for this particular treatment, but I am so much confused that how I should enter these treatments. So what happens at that time, the physician, the duty of the physician becomes important here to guide the patient that he should go at which direction that will be helpful or that will be very much effective for improving the patient. So basically our main aim should be on the patient centered decision making, or sometimes on the shared basis decision making, when both the practitioner and the patient, they both jointly decide that where to go, which directions to follow, whether they need to move towards the homeopathic only, or whether maybe there is some sort of condition in which there is a serious mode of disease condition in which we know, being limitations in our pathy, sometimes we need to take help some of the conventional mode of treatment. So at that time it becomes the duty of the physician to guide rightly towards the patient to maintain the trust. Next slide, sir. So for that, the basic main important point is we need to build the patient trust and confidence, and it only comes through the patient autonomy when you are giving the rights to the patient to decide their own treatments, their own risks, and their own benefits. Then comes that to promote the beneficence and non-maleficence. This is very important ethical standard in order to maintain that we should merely think about the interest of the patient, and we should not even harm the patient. This is the main ethical standards in homeopathic practice also. And for that, we need to maintain the evidence-based practice when you don't actually want to harm the patient, because there are some still medicines which need to be researched a lot, or there are some unsupported remedies, still we don't have some evidence, right? And if sometimes the patient demands such medicines for us, like by searching the Google, or they are Googling, or through social sites, no, they are aware of their diseases, their medicines. So when they are demanding these unsupported treatments, then it becomes a duty of the physician that you need to hold your profession integrity. You need to guide the patient that this sort of medicine is not correct for your basic treatment. You can approach some more benefited medicines which are evidence based, right? So for that, the main point, after when you have guided everything, this comes the next ethics, that is ensuring the informed consent. It means that when you have told everything about their disease conditions, about their pros, about their cons, about their risk, about their benefits, and even about the treatment outcomes also, then it becomes now duty of the patient that you are taking informed consent for the patient, whether you need to still go for the treatment, or you need to back out, or you refuse the treatment, right? So this is very important when you are taking consent, no? So at that time you are building a trust with your patient, you are empowering your patients, they have a total faith on the physician, that they are thinking that they are not the simple, the passive intakers of the medicine, but they are the active participants, which means that they will be easily comprehensible or understandable to their physician. What they will tell to their physician, the physician is going to listen them very carefully, and so when the patient is considering all these things, he feels that he will be well so soon. So the main next ethic is my topic also regarding today's topic, that we need to balance this patient autonomy with the professional responsibility. Like I can give her one example to you, that sometimes what happens that when a patient, when we are guiding the patient, or when we are telling or informing the patient each and everything about his condition, present condition, then what happens? Sometimes the patient demands some sort of unsupported medicines which are not evidence, which don't have any good evidence, and your responsibility here is to provide an evidence-based therapy, right? So there comes a clash between uh, the thinking of the patient and the thinking of the physician. So then again you guide your patients, but still the patient is stuck on the thing that no, I just need this medicine only. I have searched on the net, it has very good results. Then what happens at that time? Physician should then respect the patient, but the most important point here is that he should document that informed consent, or he should document the medicine which the patient preferably needs to be taken at that time. And then he should take a good follow up of the patient, so that he should be good contact with the patient, and should see whether the condition is in progress or not. Next slide, sir. So these were some ethical standards which should be maintained in our homeopathic practice. Next one is that the concept here, how we should understand the autonomy, that I have already explained. That what is autonomy? It is basically the individual right to make their own decisions, to govern themselves, to based on their values, their beliefs, or their preferences. And basically, it is the patient's ability to make their informed choices and about their treatment, about their care, and respecting their personal dignity is all responsibility. Next slide, sir. So in homeopathy also, I have already told you that this concept is very valid here, very relevant here, because mainly our treatment is based on individualized approach, and the understanding about the physical, emotional, and psychological states is very important. Next slide, sir. So what are the benefits of patient autonomy when we are honoring the patients or respecting the autonomy of the patient? So as I've already told, that the patients, we are increasing the empowerment of the patient, the trust we are building, we are increasing the trust of the patients. We are satisfying the patient that the preference or the decisions which the patient is giving is definitely going to provide better results to the. Next slide, sir. So what is an informed consent? This is an also important part of autonomy, that autonomy is just the basic rights of the patients, in which you are giving each and every concern or the discussion regarding about the disease condition. And the consent is when you are taking the voluntarily permission of the patient to what sort of treatment should be given to the patient. Next slide, sir. So this is the role of informed consent is homeopathy. Basically, we are respecting the patient autonomy when we are taking the consent from the patients. We are mainly dedicating ourselves for the personalization of care to the patient, because by knowing the decisions of the patients, now we are also free of mind. We are also maintaining our ethical standards, that the patient is giving consent for any sort of treatments, that if something homeopathic aggravation occurs or something like that occurs, which you know, and you have already informed their patient that their disease might be get aggravated after intake of the medicine, then you are already patient, and now the patient knows that maybe I also need to wait for some time, because my disease can aggravate for some time, and after that I will be happy with the better results of the disease. So this personalization of care is important only after when you are taking the informed consent from the patients. The very important point is that when you are taking the informed consent, it means you are providing clarity of each and every situation to the patient, that what risk or what pros and cons can occur when you are taking such sort of treatments. The next important point is that you are building trust. If you are taking consent, means you are uh, uh, taking the consent from the patient, taking his permission that what sort of treatment now you prefer, and after that you should document also that consent. Then a clarity, a transparency comes, that if somehow any claiming or something will not come, because you are ethically in your safe side now. This is the role also, that we are now legally and ethically in the safeguard position, because now you have given a very respect to the patient autonomy, and secondly you have taken the consent also, and the decision for taking this medicine is merely now on the patient. Next slide, sir. This is very important point. When you are respecting the autonomy, and when you are preferably taking the voluntary consent from the patient, then the shared decision making sometimes becomes benefit for you, that even after sharing your extreme knowledge, even you are respecting the autonomy, giving them treatment options, telling them potential benefits, telling them about their risks, and everything, and still you have provided all this information, and voluntarily you have taken permission also from the patient that what sort of treatment the patient prefers, only then you are going to provide that. But sometimes a clash occurs, that the patient still need to have a choices which for the treatment is not suitable, but the physician thinks at this mode of stage, because the patient's disease is in the chronic stage now, and the patient thinks that along with the homeopathic medicine, the patient should be given some conventional mode of treatment, also some other having some mode of practice, so that it will be helpful for the better results of the patient. So at that time, when you are guiding the patients, and the patient is not confident in giving you the voluntarily permission for such sort of treatments, then after your guidance, a shared decision making occurs, that is the decision for taking a particular medicine is made between the physician and the patient. So this is known as the shared decision making. Next slide, sir. So, along with that, sometimes the clash also occurs, or some dilemmas also occurs, when the patient is so much obstinate regarding his cultural beliefs, or some about his personal health beliefs. At that time, it becomes difficult for a homeopathic physician to deal with such kind of patients, when some sort of personal beliefs are there, or some sort of religious beliefs are there. So at that time, it becomes the duty of the physician to still respect their patient, to still go with the patient autonomy, let them decide what to do, where, which treatment should they follow, respecting their culture, respecting their personal, and respecting their health beliefs. And due to this, a shared decision making will be helpful at that time. So through this, we are also helpful in navigating those ethical and practical challenges. Next slide, sir. So I have used this picture also, in which the physician is giving all the detail, uh, and discussing and guiding his or her patients regarding the disease conditions, about the treatment outcomes, what could be the risks of having any mode of treatment, and after this, they are enhancing the trust, improving the patient satisfaction, and it also aligned with the homeopathic holistic approach also to heal the individual as a whole. Next slide, sir. So, as the topic is balancing the patient autonomy with the professional responsibility. So, let us now study that what is the professional responsibilities. So, basically, the main professional responsibility of the physician is to prioritize the well-being, the safety, and the rights of their patients. And for that, we need to maintain the competency, we need to adhere to the principles, and for that, ensuring honesty, integrity in practice also. Next slide, sir. So this is the picture which confirms that if we need to balance, there is always a hand of guidance, that is of the physician, which always balances the autonomy with the professional responsibility. Next slide, sir. So this I've already told you, this is the main responsibility of the homeopaths to uphold the standards of care, to practice competently and to adhere to the ethical principles in order to build trust, ensuring safe and effective homeopathic treatment. Next slide, sir. So for that, amongst that, what we need to follow the principles, or what we need to be, what could be the responsibilities? The very first responsibility is prioritizing the safety of the patient. For that, we need to ensure the non-maleficence, means we need not to harm to the patients. We should avoid the overprescriptions. Whatever is needed, we should stick to our principles of minimum doses, similar doses. So we always need to avoid the over prescriptions. And the most important is follow-ups. We should maintain a long-term relationship with our patients so that we could be helpful in monitoring the progress of the patients for the long-term basis. Next slide, sir. Next one is, how can we provide the evidence-based care? We should be very basing treatment on the science and research. We should always be updated with the evidence-based practice. And the most important point is, along with our knowledge, our upgrading, we should always guide our, educate our patients also, so that they should be aware for their own disease conditions. So next slide. So back. One more.
Hello.
Sir,
Hello, ma'am.
fourth point.
Fourth point. Uh, is this okay?
Yes, sir. Yes, sir. Yes.
Okay, okay.
So the next one is maintaining the professional integrity. For that, we need to be very much ethical in our communications. We should always be based, our medicine or the treatment should always be based on the evidence based. We should always be committed towards our patients and even to us also, that we always be remain updated by having help of the continuous learning, maybe through webinars or maybe through seminars or some international conferences. And the most important point to be updated is learning from our own experiences. And the most important next point for the continuous learning is to be advancing in the field. Like we can grow by publishing our articles, by publishing our research papers, or all these things helps us keeping us updated, and so that this could be helpful for the practicing that is always an evidence based. Next slide, sir. And when we are updating ourselves, it means that we have an accountability towards our patients also. Definitely the outcome or the results of our treatment will be perfect ones. And the most important point is that we should be always collaborated or in contact with our peers, because when we are discussing our failures, when we are discussing about our success or about our cases, how you dealt with that, so all these things are definitely bring and very much good impact for the homeopathic physicians in our practice also. And the most important point is that we should always be adhered to our rules, regulations, and when we are adhere to our ethical rules and regulations, and definitely the practice of homeopathic physicians can be upgraded a lot. Next slide, sir. So the main topic which I have chosen here is to have a balance between the patient autonomy and professional responsibility. We have discussed these 2 points, that what is autonomy and what is professional responsibility. Now the thing is that what sort of conflicts are occurring or can occur in our practice, that so that we need to balance those conflicts or the dilemmas. So the conflicts which the patients come to us is that what treatment you are recommending, but the patient is not willing to take that treatment. He always refuse for that particular treatment. Like these kind of dilemmas can occur. Next is that dilemma can occur, or the next conflict is like preferences for homeopathy in place of the conventional medicine for the serious condition. This is a very good example, like some aged people in our homes also, like for some sort of high blood pressure, they always demand that I will take this homeopathic medicine, I am not going to have the allopathic. But there are some situations that we know our limitations also. At that time, to sort out this conflict, we are guiding our old ones or some sort of our patients also, that at this time, in order to avoid any unethical practice, we always navigate or such decisions so that it could always be beneficial for the patients. And sometimes the patient requests us for unproven treatment. So these are the basic conflicts which we are facing, maybe uh, not on the daily purpose, but there are some dilemmas which we face in our practice. Next slide, sir. Next slide, sir. So these are the points which we'll discuss how we can balance the autonomy with the responsibility. Next slide, sir. The most important point is that in order to get rid of those conflicts, we should recognize the scope and limitations of our pathy. This is very important, that we should not always tell our patients that yes, through homeopathy we can cure each and every disease, we can do this, we can do that. No such claiming we should avoid, because we are aware of that limitations, and so should we guide to our patients also that this pathy has some sort of limitations, and the main responsibility of a physician is to guide rightly, so that the outcomes of the treatment should be beneficial for the patient. We are not going to harm the patient. So that is why the main priority is the safety of the patient. If we need some sort of interventions with that, along with our homeopathy, we need some conventional mode of treatment, then we should guide the patients for that also. We should even provide honesty and transparent care. We should not keep any hindrance, or we should not tell the right thing to the patient. This is not correct, and this is not ethically correct, that we should hinder anything from the patients. And the most important point is we should never reassure about that this pathy is the best one, you should take this only. We should always avoid the over promising. Next slide, sir. The most important, when we are talking about the limitations, it means there are some cases which need some reference also. For that, we could refer our patients to for other mode of treatment or the conventional mode of treatment in order to save the life of the patient, maybe in some acute conditions or some emergency conditions. Maybe in those diseases, some complex multi system is involved at that time. Some sort of other conventional or complementary system help could be taken for that. complex multi-system diseases, or sometimes when the symptoms are unclear or the symptoms are getting worse day by day. So at that time, we can refer the patient for some diagnostic procedures. Next slide, sir. Then it's very important for us when we are considering our limitations and we are guiding the patients also, then it's very important for us to collaborate with the other healthcare providers also, because our main aim, our main ethical responsibility is to treat the patient safely. For that, we can approach for an integrated patient care. We can even promote patient trust and safety measures, facilitate some other sort of commitments which is always necessary for the care of the patients. And for that, we should be stick to our professional standards for our ethical, and even we should maintain here our professional integrity to uh, uh, in order to be upgrade even the homeopathy practice also. Next slide, sir. And for that, the most important point is how can you get out from these type of conflicts through only with the help of the clear communications with your patients, and when you are educating your patients. For that, transparency is very important. When you are telling each and everything about their these conditions, about their treatment outcomes, about what risk could be there if they are going to take any sort of treatment. So these are very helpful to maintain a balance between those conflicts. Next slide, sir. And that could only be possible when you are listening to the patients very empathically, and you are emotionally connected with your patients. Only then it's possible when the patient is going to tell each and everything related to his family, related to his mind. Only then he is able to be with you. So and understanding their viewpoint, understanding and to maintain the trust, encouraging them to be with you to tell each and everything. So it's very much important to listen them very carefully and understand them. Next slide, sir. And then sometimes, as I've already discussed, that even when you are able to manage all these points, when you are respected the autonomy, when you have given them the informed consent, when you are willing to take their consent, but still the patient is so much confused where to go. The best example here I can give, like for example, when uh, parents are coming with their child for some sort of homeopathic treatment to homeopathic physician, and one parent, maybe mother, is going towards the preference for the homeopathy, while the father is preferring some conventional mode of treatment for the child, because the disease condition with the child came here, maybe some sort of a skin ailment, which is a very rare sort of disease. So at that time, the decision by the parents to take, because both of them are going toward different directions, so it becomes very hard for them to decide for their child. So at that time, it becomes the mere duty of the physician to guide the parents that what would be more benefit for their child, and the physician should guide each and every point regarding the pros and cons of the medicines which the physician is thinking to prescribe for that particular skin disease. So here the shared decision making would be helpful. Next slide, sir. So these are the points which are helpful when we are balancing all these points, when we are collaborating with the patients in decision making, which is the key ethical principle, that when we are providing the comprehensive information, when we are respecting the patient preferences, and then we are guiding with facilitating the shared decision making to the patients, because we are offering a number range of options to them. We are empowering the patients, we are clarifying the patient's expectations, and allowing or giving them time to think over, and we are maintaining and providing an emotional support which are definitely going to build an trust with your patients. Next slide, sir. as I've already discussed, that when you are dealing with all these conflicts and still the patient stick to those mode of treatment which you think is not ethical, or you think it's not the evidence-based practice should be given, or the evidence-based medicine which is still under observation or research should not be prescribed to the patient, but still the patient wants or needs to go for that particular treatment, then it's very important that you should make your medical records in order to safeguard ethically and legally also. And you should document all these discussions and decisions. Next slide. So these are some ethical dilemmas. Means ethical dilemmas, they are the conflicts which can occur between two or more moral values, and where sometimes what happens, no clear solution is there. So at that time, you need to make a balance between the patient's beliefs. You need to value them. You need to consider the preferences of the patients. At that time, these dilemmas can be washed out. Next slide, sir. Next slide, sir. So when we are talking that what sort of conditions can occur in the patients that can be controversial or can be very complex in nature, that may lead to the some controversial or conflict between the patient and the physician, maybe some sort of that diseases in which their controversy can occur are like some treating some children, treating pregnant women or terminal ill patients, or the patients with some sort of mental health issues where there are so much risks in taking some mode of treatment. So preferably in these cases, you may feel some sort of conflicts between your moral principles and between the autonomy or the rights of the patients. Next slide, sir. Next slide, sir. Next slide, sir. So I have taken some sort of practical scenarios or case examples, which you will be able to know that what sort of dilemmas can occur and how you can navigate or sort out those dilemmas. Next slide, sir. So this is an patient, a case of an chronic joint pains. And the patient here demanded, when you are taking a patient autonomy, when you are discussing or telling them about their disease conditions and treatment options, and they support an unsupported treatment, or they need to go for some sort of unsupported treatment in which you are not well aware, and you have not much known about, because that particular drug is not evidently based now. So at that time, what will happen? Uh, in order to give preference to your patient choices, you need to guide them that toward more suitable evidence-based practice, which you are aware through your experiences or through your higher research studies. But still, the patient needs to go for that unsupported treatment. So how will you approach ethically here? That you will engage in the respectful conversation about the pros and cons of the requested treatment to your patients. You will empathize with their desire for the relief and acknowledge their research efforts. Then share the evidence based insights on alternative treatments explaining why they might be more affected for their condition. So the main important point is that you need to guide your patients, that you should not pressurize for any sort of medicine which you desire to give to the patient, because it's very much important for taking their voluntary consent and fulfilling their desire, also fulfilling their autonomic, respecting their desires, respecting their autonomy, in order to provide the optimal care to the patients. And still, despite your giving full guidance to the patient, still the patient needs that unsupported treatment, then do document each and every decision taken by both of the patient and the physician, and be always keep your eye on the progress of the patients. Next slide, sir. So these I have already told you about. I have already given an example to you that there are so many people, especially in home also, you'll feel there are old age people at your, maybe your grandparents. They have high blood pressure, no, so they will always press it that I will take homeopathic medicine from my child, and I won't prefer some conventional mode of treatment. But you know that some sort of complications can occur. So at that time, you definitely recommend that you take homeopathy also, but conventional medication is necessary for your disease condition. So what ethical dilemma here is there, that this ethical challenge lies in respecting the patient autonomy to choose their treatment versus the responsibility to ensure the patient safety. So how will you ethically approach here? You will openly discuss the potential risks of untreated hypertension, emphasizing the importance of managing the condition for the long-term health benefits. And you can here propose a combined approach, suggesting that they can use homeopathic treatment also alongside of the conventional medication. So by educating the patient on both the options, you can document your conversation and also honoring the autonomy, respecting their autonomy. Do document each and every medication or the treatment you are providing to your patients. Next slide, sir. Next one, sir. Next slide, sir. These were some cases and the scenarios which you can come across in your practice, day-to-day practice. So it's very important to balance this autonomy, balance the rights of the patients and your professional responsibility, in order to always, the balance is needed to ensure the practice which you are performing, your responsibilities, it should be an ethical one. And the more important point is very crucial is for upholding the ethical standards and fostering the trust of the patient. So empowering the patients to make the informed choices, respecting their autonomy, while the professional responsibilities guide practitioners to act in the patient's best interest. And definitely it should also be based on the evidence and safety. So this balance is the cornerstone of the ethical homeopathic practice, and it ensures that patients will feel respected and involved in their care, while practitioners maintain integrity and adhere to the ethical principles. So like this, we can easily balance between the patient's choices of treatment and between your responsibility, which is better for the good outcomes of the homeopathic treatment. Next slide, sir. So this is a very important point for an homeopathic physician, especially for the budding learning homeopaths, or which have just joined their new clinics, that these dilemmas, how they are going to judge these dilemmas, or how they are going to sort any kind of conflict which occurs between their patients. So these are the three modes through which we can come out from these dilemmas. The very first point is through formal supervision. It means that sometimes you could need the help of a physician which is highly educated, highly experienced in the field of homeopathy. You can take the guidance from them. You can tell your any conflict situation which you are in, and you are not able to come out from that situation, and through their experiences, through these formal discussions, they are able to help you, to guide you to come out from the situations. Next, ethical guidance could be an informal one that could be taken from your like teachers or your the homeopathic physician of your areas, with which you are not so much formal, like you are meeting daily with them, like and you can discuss with them, like your colleagues also. You can discuss that I am facing such a problem, then how could I come out from that? So this is an informal kind of supervision you can take help from. And the very important is the peer support. Like all the budding homeopaths which have newly joined their clinic, they should attend some sort of seminars or some sort of conferences in which they could easily discuss their failures, they could discuss their successes of their cases, that how they uh, took the decisions of prescribing to their patients, or what sort of conflicts they face between their patients, because the mindset of two budding homeopaths is same, so they can easily comprehend each other, they can easily understand each other. And by knowing about their failures, knowing about each other experiences, they can even ethically also they can guide to themselves and give important feedbacks to their fellow homeopaths. So these are the three main points of discussions which one should keep in mind, and one should aware also, and should always remain updated, uh, can take the help of their peer reviewers also, and should always be uh, get into the researches or get into the publications through readings, through updating themselves, which is the very much important mode through coming out from such sort of conflicts, and can easily get into balance between the autonomy and their responsibilities. Next slide, sir. And that is why I have mentioned here that together we can progress, and together we can uplift the homeopathy by building us together towards a mere ethical future in homeopathy also. Thank you.
Thank you, ma'am. Thank you so much for the wonderful session. Participants, we are open for the questions now. Ma'am, while we are waiting for the questions from the
Yeah,
participant, I
sure.
would like to ask you one question.
Yeah.
As you mentioned that we always needs to be keep on updated on new rules and ethics so that it will be easier for us for the guidance. And
Yeah.
also help us that through which we can be able to get updated. Like, is there any kind of a specific website or any help? Ma'am, am I audible?
Yeah, yes, now you're audible.
I'm so sorry. I was asking one question that you mentioned that we always need to be updated on certain rules and regulations so that it will help us to be ethical on our homeopathy. So, is there any kind of a website or any link or something through which we will be able to get the updates?
Yeah, sure, ma'am. Actually, we have so many, like might have heard some sites like regarding the Scopus, PubMeds, Google Scholar. These are very important sites in which research scholars. So basically, these sites, they so many articles related with the research, related with the articles, ethics, especially we will get to know mainly research sites in which all the data are available regarding that how can be you be so confident in your practice, how can you be updated with your practices, and articles basically not only related with the homeopathy but the conventional mode of treatment, because still there are so much things which are need to be upgraded in homeopathy, and all that we are able to search these articles, these updated studies, uh, through which we can get guidance. There are so many journals under these proper, like Scopus contains so many international journals, some research related journals, which guide us a lot, and we can get into these ethical practices also.
Ma'am? There is one question from the participant. Any
Yeah.
kind of form which help to concerns patient? Please share.
Ma'am, please repeat the question.
Question is any kind of form which help to concern patient.
Any kind of, ma'am, your voice is disturbing.
I'm so sorry. Now can you hear me, ma'am?
Yes.
The consult the participant is asking if you have any kind of a form, like which can be distributed to our patient, which will help the concern of the patient. If you have any kind of a format of the form, if you can share that.
Any kind of format.
Yes, ma'am.
Format regarding case taking format or some related to ethical performer, some sort of what kind of format?
Sir, Dr. Vijay, sir, please elaborate your question. A format regarding ethical practice.
No, actually, ma'am, whose question is this? The thing is that the examples which I have given to you is some sort of experiences which I have faced in my clinic, and the some which I have heard from my peer colleagues too. These are a few ones, but when you are going to experience your own clinical practice, you might have some other sort of dilemmas or conflicts which come to your notice. So at that time it's all depend on your upgradation of your knowledge, what you have learned through your BHMS studies, and your if you are an PG you have done, or through PhDs you have done. It all depends that what you are seeking or what you are studying day by day, or what your experiences in your clinic, only that would be helpful in coming out these conflicts. So at that time, you the only thing here is that you need to document your own records, maybe through computerized records or through registers, whatever you feel. This is the only thing you can maintain an ethical way to deal with your patients. Whatever they are saying to you, whatever they have understood you, or whatsoever the treatment they have demanded you, despite what you have explained anything to them, you should document them, because this is ethically safe for you. That if someone claims for you with any sort of conflict which they have not come out still yet, they feel, then with the help of these medical records, you can easily be safeguarded legally also and ethically also.
Thank you, ma'am. Thank you so
Yes.
much for putting the light on this.
Okay, ma'am.
Participant, we are still waiting. If you have any questions, please ask. I don't see any more questions here.
Yeah,
So,
okay, ma'am.
okay. Thank you so much, ma'am. This is the very wonderful session. I'm obliged to have you here on this to the topic, which is ethics in homeopathic practice, balancing patient autonomy and professional responsibility. The discussion which you had and given us the information that will really help our practice and to fruitful sessions. And there is one question, sorry.
Yeah.
Which website help to limitation and scope?
Helps in knowing our limitations and scopes.
Yes, ma'am.
There are our homeopathic books also, ma'am. It's very important that you should reread. The rereading or reviewing our even our books are very important. This will definitely help you to know about our own limitations and scopes.
Thank you, ma'am. Thank you so much. And you can also read the organon of medicine again and
Yeah,
again so that you
definitely,
will be
ma'am.
more sure. Yeah.
Yeah, definitely, ma'am. Our own principles tell us each and everything. One should always see, ma'am, this is the basic updating ourselves that whatever when you feel like if you read 100 times, 150 times when you read the Hahnemann's Organ of Medicine, definitely you are going to grasp one new word from that. Because every time you read a definite something you are going to gain from that. So our basic father, Dr. Hahnemann's teachings are so perfect that he has explained each and everything from that. So our basics, our principles are very important to because when you the first my first slide was related with the oath, especially declaration which Dr. Hahnemann made. The students which take at the time of registration, each and every word in that declaration and oath reminds us the ethics which we need to follow in our practice. So that particular oath, definitely when you stick to that oath, when you stick to that declaration, you are definitely going towards that uh, ethics and the practice what you are going, or you are maybe a starting homeopath or whatsoever you are, on which stage you are definitely going to do perfectly when you are sticking on your ethical principles. So our books, our main Dr. Hahnemann's guiding books are the very important part in order to do ethical practice.
Thank you, ma'am.
Yes.
Ma'am, one of the participants is asking if they can have your email ID so that they can refer if there is any kind of a doubtful case in future.
Yeah, sure, ma'am. I should say, ma'am, or I should, how can I provide that?
Ma'am, you can type it in the chat box.
Uh, okay. Got it, ma'am?
Um, Not yet.
From my side,
Oh,
ma'am, it's like,
okay, ma'am, no problem. You can share it with me. You can say it. I will type it here.
okay, I should say
Ma'am.
RUCHI
UCHI
BIS
BIS
WAS
WAS.
dot
Yes, ma'am.
RB
RB
@gmail.com.
@gmail.com.
जी,
I'll just
Ruchi
inform
Biswas,
myself.
ruchibiswas.rb @gmail.com.
Thank you so much. And there is one question that, madam, in your clinic, do you make
Yeah.
any kind of a format of patient's treatment concern? If you have any, then you can share it, please.
Ma'am, at this time, I don't have right now. If anybody needs, they can mail me, ma'am.
Thank you so much. I don't see any more questions here. Okay, that's.
Okay, ma'am.
Thank you so much, ma'am, this
Ma'am,
wonderful session and your precious time, for giving this time from your very busy schedule. We are very much
any
humbly.
pleasure also, ma'am. Thank you
Thank
so
you, ma'am.
much.
You're welcome. Thank you so much for the participants having actively participating. And please do not forget that we do have our international conference, which will be conducted on the 12th of January in Kolkata. The links has been already shared in the chat box. Please visit our WhatsApp group for the in-depth details. And if you still have any issues, we are just a call away. Thank you so much, ma'am, and participants and everyone, the staff members and Region Publications to have here. Good night, everyone.
Okay. Good night, ma'am. Thank you.
Thank you.